actually started as an orphanage in the 1800s. If we were creating a timeline, I think we would put Match on that timeline. I think it's been that transformational. We had been doing functional family therapy as a pilot with philanthropic dollars for about 2 years and looking at becoming a Medicaid provider in order to help that become sustainable, to grow, to serve more families. When we applied to Match, I think we had 50 families on our wait list for services. And it we realized how difficult the journey of getting a Medicaid number is for a nonprofit. You really have to be accepting private insurance and have that track record. It looked like a brick wall in order for us to be to form a relationship with DBHDD and to be able to seek Medicaid reimbursements. When Match came along, it was our opportunity to receive additional funding, but also to form that relationship with DBHDD. We've been able to be a part of the conversation for sustainability, for therapeutic foster care solutions, for additional solutions to gen approaches that would keep more children out of PRTFs. And then we've been able to grow relationships within DBHDD. So for example, we were able to show some of our prevention work and training work at the recent Systems of Care conference. We would have never even known that existed, and we wouldn't have had those relationships had it not been for Match. I think the relationships that we've gained, the understanding of sustainability for these models, and even just the understanding of all the models that are out there that are doing the work that really fills in the gaps in our system has been great. We've been able to form new relationships with service providers, such as youth villages and Hillside, because of this, and really getting to know the DBHDD system and all the work that they're doing and people within that system. No matter what you do, it all really comes down to relationships and getting to know people and collaboration, right? When we have for 150 years, for as long as DFACS has been around, that's been our primary relationship within the state. And really getting to know a new system like DBHDD or DCH, DJJ is overwhelming. And Match has been a place where all of those folks gather. And so we've been able to form relationships and understand the environment in a way that I think is transformational for our organization. FFT is an evidence-based model. There are very specific ways in which we need to measure success, but it's more clinical, right? And it's not talking as much about the outcomes that families are seeing in their lives. And so with Match, we've been able to really look at how's a kid doing in school at the end of this, right? How many behavior incidences are we seeing along the way? Have they had any law enforcement interaction while they've been with our program? And we feel like the partnership with the Center of Excellence has been really great in helping us communicate and really define what success looks like for this model in Georgia. We know that for every dollar spent on FFT, there's $17 of community gain in return. And so we really appreciate the ability to demonstrate its effectiveness to serve these families that have tried a lot of different things, right? And haven't seen the results or haven't been able to sustain the results that they need. We are excited that there's some conversation about prevention and moving a little further upstream and want to be a part of those conversations, are excited about that, and thankful that there's a table in Georgia where when we don't know how to fill a gap, there's an incredibly smart, dedicated group of people thinking creatively about how to fill that service gap for the children of Georgia and the families of Georgia. Because when they're healthy, we're healthy.